every patient is a privilege to care for. But when I have a patient who's also a doctor, I know in supporting that individual to optimize their lifestyle, that's going to pay it forward in great fashion, because now all of a sudden the way that they practice medicine moving forward has changed.
Yeah.
It's been modified. And that's going to affect each and every one of their patients and each and every one of their experiences with other peers. I think we have a responsibility to educate and act as mentors for interns and residents and medical students. And so it's this beautiful, all of a sudden it flowers, you know, and we can, by changing one life or by introducing these powerful aspects of lifestyle, it's infectious.
Season 3 of the Plant Strong podcast explores those Galileo moments where you seek to understand the real truth around your health and dare to see the world through a different lens. This season, we honor those courageous seekers who are paving the way for you and me. So grab your telescope, point it towards your future, and let's get plant strong together. Hello, everyone. I'm Rip Esselstyn, and this is the Plant Strong podcast, where each and every week I bring a wide variety of guests to talk about the subject we all love, the power of plants to change the world, prevent and reverse disease, but also greatly enhance the quality of your life. You are in for a treat today as I dig in deep into the all-encompassing world of lifestyle medicine physician Dr. Saray Stancic. Her story has a little of everything that will have you on the edge of your seat. Personal trauma, transformation, redemption, discovery, and a passionate pursuit to change not just her health and the health of her patients, but of the healthcare field as a whole. Not a small task, but as you'll hear, this plant-armored warrior is more than up to the task. It hasn't been an easy climb. In 1995, as a third-year medical resident, Dr. Stanzik was diagnosed with multiple sclerosis. At the time, it may as well have been a death sentence for this young doctor. This unforeseen health challenge changed the course of her life, both professionally and personally. And today, we talk about the impact that diagnosis had on her life, as well as her Galileo blueberry moment that ultimately changed the way she viewed her prognosis. Today, over 25 years later, in addition to being a physician, you can also add marathon finisher, filmmaker, and author to her long list of credentials. Her film Code Blue examines the healthcare industry and offers solutions featuring the practice of lifestyle medicine to prevent, treat, and manage disease. And her new book, What's Missing from Medicine, offers 6 lifestyle changes to overcome chronic disease. We go deep into these 6 lifestyle habits, so let's not waste a single moment. Prepare to be empowered with the incomparable Dr. Saray Stancic. Let me start by asking you this, because this is season 3 of the Plant Strong podcast, and in season 3, we're really trying to understand the person that I'm talking to, their Galileo moment, and what allowed you to look through the lens of that telescope and then see kind of the truth that kind of sets you free, and then also informed your path forward. And with you, I think it's pretty powerful. Yeah. And so I'd love for you to share that.
Sure. Well, you know, my story really begins in 1995. At the time, I was a third-year medical resident, and I was in the midst of a call, working in, 24-hour shift. And I woke up around 3 o'clock in the morning to find that I couldn't feel my legs. And that led to the emergency room, an MRI that confirmed the diagnosis of multiple sclerosis. And so there I was, 28 years old, abruptly learning that I had this chronic disease incurable chronic disease. And I knew in that moment that my life had changed dramatically and irrevocably. And so...
Did you actually have like lesions? Was that diagnosed
Multiple
then?
lesions in my brain and spinal cord. And in fact, the burden of disease was significant. I mean, when the neurologist saw me, he said, Saray, you need to start planning for a future that may lead you to a wheelchair, a nursing home setting. I mean, these were all the terminology that he used at that time.
That was 25 years ago.
25 years ago, yeah. And he told me that, I know this diagnosis is difficult, but here's the good news. A new drug, the first drug had just been approved for multiple sclerosis, a drug called beta-seron. And he said, this is a drug that is quite effective, but it's not going to be easy. It's a drug you're going to have to inject every day, has a significant side effect profile, which is numerous. But he said, it's your only, this is your best chance to reduce or slow down the disease. You can't cure the disease, but he said this was the way in which we could slow it down. Buy more time. Meaning buy more time where I wasn't disabled. So, of course, I was going to do whatever he asked me to do. I mean, he was a leading MS specialist, and so I started the medication. And the side effect profile was difficult to manage. I mean, I would wake up, I would inject the drug at 10 o'clock, and at 2 o'clock in the morning, like clockwork, I would wake up, Rip, with violent shaking, chills, fever. I felt like I had the flu. I couldn't sleep. The injections were every day, and I would develop these really painful injection site reactions. I almost looked like a leopard, because at some point I ran out of real estate, like where do you inject? And after doing this for some time, I just, a month into this, I can't do this anymore. I mean, I'm ready to give this up. And when I approached him about it, he said, are you crazy? You can't. This is your only chance. You have to remain compliant with this medication, or you're going to be in a wheelchair within 10 years. So his solution to the problem was, what we'll do is we'll treat the side effects of this drug with other drugs, right? So when I couldn't sleep, I was given Ambien. When I couldn't wake up, I was given Provigil, an amphetamine-like drug. And when I became depressed, I was given Prozac. So you can see the pattern here. By the time, a few years into the diagnosis, I was taking about a dozen medications. I was a young woman walking around with a pill box. The disease progressed regardless, despite...
A young woman physician.
Young woman physician, yeah. Going through my residency, my chief resident year, my specialty as an infectious disease specialist, I mean, I fought my way through all of that. With the pill box, with the cane, with the diaper, the humiliation of it all. And I grew hopeless. And then my moment, the aha moment.
And this aha moment, what year was that?
2003.
So you've been living with the MS and kind of the meds and stuff for 8 years? 8
years, yeah. And an exacerbation probably at least 2, maybe 3 times a year, where an exacerbation in MS is like, it's an extraordinary disease in that you might feel well today and then the floor falls out from under you the next day, like you develop something called optic neuritis, blindness, or you wake up and you can't feel your legs, or you wake up and you have a weak arm. It's unpredictable, and throughout all of there's this fatigue that's hard to describe, but you feel like it's hard to just get up out of bed. And somehow I'm managing to get through this. I'm the chief of infectious diseases at the VA in New York, and I'm sitting in my office one day, and my secretary drops off mail, and on top of this big stack of mail, I see a journal, and on the cover of the journal, I see multiple sclerosis and blueberries. And I think, what is that all about? So, curiosity, I picked it up, I turned, and it was a very small poorly constructed, unscientific study that essentially took a group of MS patients and fed them a diet enriched in blueberries. And these doctors or scientists suggested that it was the anthocyanin, the phytonutrient in the blueberry, that was playing a role in an anti-inflammatory fashion, and that it was somehow the patients that were eating this blueberry-enriched diet subjectively felt better. Now, as a physician and scientist, you know, that's not an objective clinical endpoint. And I sort of thought this is, you know, sort of wonky and not very serious. Had lunch with a colleague of mine that afternoon. He was a neurologist. I told him about it. He laughed. But you know what, Rip? I couldn't get that silly study out of my head. I just kept thinking about those blueberries. And
not your favorite fruit.
Yes. And I said to myself, an important question started to arise from that line of thinking as I thought more and more. And it wasn't that I thought eating the blueberries was going to resolve my issues, right? For the first time in my adult life as a practicing attending physician, dual board certified, I considered the following question: could diet and disease, could there be a connection? And isn't that extraordinary that here I was a physician and I knew nothing about nutrition and its role in the formation of disease? It's hard to fathom.
Yeah. Well, it almost seems, knowing what we know now,
Yes.
egregious. Like, wow, what a miss.
Yes.
Huge miss.
Huge miss. But in that moment, it catalyzed this insatiable appetite in me. Like, I want to learn as much as I can about these connections. And so I delved into the literature. First study that I came across, published in 1952 in the New England Journal of Medicine, Roy Swank, who was back in the 50s, he hypothesized that saturated fat was playing a role in the pathogenesis of multiple sclerosis. And back then, he started treating patients with a low-fat, plant-based diet.
Yeah.
And people thought he was crazy. But he followed about 140 plus patients over 34 years, ultimately published data in The Lancet, 1990. And he found, and he reported then, that 95% of his patients were disability-free. And I was like, oh my God, every time I see my doctor, he's talking about this wheelchair. Is there something to this? And it wasn't just Swank. There were several other publications in the literature that spoke similarly to the same. And it wasn't just food. It was all these other aspects of lifestyle that play a role in the formation of disease. And so anyway, I just consumed all of this literature. It excited me. Suddenly there was hope. I made an appointment to visit my neurologist with all of these articles, We even made copies, highlighted sections that I wanted him to be aware of. I presented my thoughts, and he was very surprised that I would consider that this could potentially change the course of my disease. And he looked at me and he said, look, because he was one of my professors, he said to me, you're a physician. I think you know better. You know that this is not going to, changing your diet and changing your lifestyle is not going to in any important way change the course of this chronic neurologic disabling autoimmune disease. What you need to do is remain compliant with the medications as prescribed. And then he said to me, there's nothing you've done wrong. It's not your fault that you have MS. The reason you have MS is because of your genes. And there's nothing you can do about your genes.
And so how did you take what he had to say?
Well, I was, it certainly set me back, I very much admired him and appreciated who he was and his expertise in the field. But it didn't take very long before I realized that with all due respect, that I felt strongly that there was something here. I mean, I had read the evidence, and I felt compelled to introduce these changes into my life. I was willing to take that risk because the alternative was my dependency on the many medications. I had no quality of life. So to me, it was, I'm willing to take this risk. But that was a personal decision for myself, and one that I discussed with my husband. It was not.
So you were married at the time?
I was married.
How long have you been married?
At the time, about 5 years.
And so he had met you, maybe, and you guys had gotten married when you had MS.
Yes, he met me 3 weeks before I was diagnosed, and he stuck around.
Well,
He's
you know what? Good for him,
guy.
because he has got to witness this insane recovery, hasn't he?
Yes, he has.
Right, and how you were just flourishing.
Yeah, and he's part of my medicine too. I mean, I have this amazing spouse who's just been with me through it all, and,
Nice.
and there's love is part of this quotient.
Right, and I want to talk about that.
Yeah.
Neurologist who was a professor who you admired and respected, and basically said, Saray, come on, you're a physician.
Yeah, stick with the meds.
Stick with the meds. This is, let's stick with the science, right?
Sure.
And so have you gone back to him since? Has he come around at all?
I did visit him around the time that I was filming Code Blue, because I actually wanted to interview him.
Yeah.
But
He didn't want any part of it?
no.
Yeah. Yeah. Well, that's unfortunate, I suppose.
He was very happy to see me, though, and he was surprised to see me walking on 2 feet and looking well.
Yeah.
But
did you hand him the stack of papers again and said, I really think you should take a closer look at this?
Yeah, and I think he still was very resistant, and in fact he thought that it could be well, he thought I should be very careful about what I never tell. Let me just make this point. I never tell MS patients not to take medicine or not to follow. I'm not an MS specialist, and they should have that conversation with their doctors. All I'm saying is, if you have MS and all you do is take these disease-modifying therapies and you ignore everything else. I mean, I've seen in my practice many young women with multiple sclerosis who are being managed by MS specialists, and they come to see me because they've heard my story and they want to learn about lifestyle medicine, and they want to introduce modifications into their own lives. But so these women will come to see me, and yes, they have MS, but guess what? They may also be obese, hypercholesterolemic, depressed, pre-diabetic, and that's being ignored by these MS specialists. And we know all of those components are promoting the progression of this disease. So I think it's unethical for us to ignore all these other comorbidities and just manage the MS, right? Because guess what happens when you introduce these lifestyle modifications? The patient loses weight, the pre-diabetic state reverses, the fatty liver disease reverses, the hypercholesterolemia reverses, and guess what? Their MS gets better.
Well, and I think the first chapter in your book, you basically talk about how these chronic Western diseases they're man-made diseases.
They're man-made diseases,
right?
Yeah. That's people don't like to hear that, man-made disease, but they are.
Yeah.
They are.
Yeah.
And some people will feel like you're blaming people. And I'm not blaming. I'm empowering, I hope.
Yeah.
The idea is to empower, not to blame. We're in trouble right now, Rip, in our country. The chronic disease epidemic is ever growing. We have a population that obesity rates are climbing every year. When I started writing the book, in the section that I write about obesity, at the time, so I'm doing my research, I go to the CDC to look at what is the obesity rate at the time, right? At the time, it was 39.8% of the population was obese in the United States.
And what percent were considered overweight? Like 75?
Right. If you consider overweight and obese, you're in the 70s, right?
Yeah.
But in 1 year, so now I'm at the final point of edits. sending in last edits to the publisher. So I'm rechecking my facts. Go back to the CDC to check the obesity rate. Now,
is there a 4? Does it start with a 4?
yes. Now it's 42.4%.
Oh my gosh! So it goes up
In 1
almost
year,
3%.
Yes, 2.6%. Is that amazing?
No, it doesn't seem conceivable.
It doesn't. But that's the state that we're in.
Yeah.
And each year, it's just when you think it's going to plateau, like it can't get worse, it does. And we just continue to go about our way. Like, I'm an infectious disease physician. It was common for me to see an infected diabetic foot ulcer in a veteran, right? And so the question to me would be, what antibiotic, Dr. Stanzik, should this patient be on, right? So I would examine these patients and find often they had bone involvement, which is what we call osteomyelitis, and that buys them at least 6 weeks of antibiotics, maybe longer, and we would debride and despite the aggressive nature and the appropriate antibiotic regimen, often these patients wouldn't get better, and so they end up with an amputation, right? So now the status post-amputation, they become more sedentary, they gain more weight, blood pressure further out of control, blood glucose. So what happens? Stroke or heart attack. And so this is not unique to me. This happens every day in every hospital across our country, and everyone, it's like normalized. Diabetics, they develop amputations, they lose their vision, but here's the thing. We have the knowledge and understanding today to prevent more than 90% of diabetes.
Right.
This is a disease that is skyrocketing in our country. The CDC predicts that by 2050, 30% of Americans will be living with diabetes. And today, we know how to prevent it. How is this not the most important message that we're all delivering in the field of medicine?
Number one. Let's just say it's 2003. You're 8 years into your disease. You're walking with a cane.
Walking with a cane.
Walking with a cane, but you're now hitting the blueberries, right?
Well, whole plant kingdom, I'm hitting it really hard.
The whole plant kingdom. Yeah. Was there a book, or was there a person, or was there something that like inspired you besides some of the research you saw? No,
I inspired myself.
Okay, fantastic.
Yeah, I just read the literature, and the literature was pretty clear that it was about fiber and this microbiome and these phytonutrients and these phytochemicals. These antioxidants and their anti-inflammatory effects, and I started to piece this together, and I started with my diet, and then the exercise. The exercise was really hard because I couldn't do much of anything. I mean, think about it. I couldn't feel my legs; they were heavy. I was walking with a cane or crutches, and so the best thing I could do was a stationary bike. And my husband would literally assist me to get on, and I could do a minute. That's it. And then I would get numb and a shower of pins and needles when he would carry me off. Numbness, pain, shower of like pins and needles. It would take about 15 to 20 minutes to recover from that. Drinking water, getting my body temperature up. In multiple sclerosis, when your body temperature gets up, you get symptomatic. It's called Uthoff's phenomenon. And so for many years, it was felt MS patients were advised not to exercise. It was felt that potentially it was worsening the disease. And when that happened, it felt like it was worsening the disease.
Yeah.
But I kept getting back on. And you know what I started to notice, Rip? That period of recovery started to lessen. And it sounds crazy that it was only a minute, but it started out as a minute, and over the months it went to 5 minutes, and I started to get stronger, and that recovery pain dissipated.
So as hard as it was to get yourself off the couch and move and exercise, it was so well worth it.
incredibly well worth it. And that fatigue, that was just that heaviness that was part of my life for the many years, lifted. And I felt energized, and I felt like, wow, this is a new beginning for me, an awakening. There's something to this.
Yeah.
And I just kept going.
You kept going, and then at some point, did you decide to take yourself off the meds?
Oh, yes. I tapered off of every one of those medications.
Uh-huh.
And
Over like what period of time?
I think it probably took 3 to 6 months.
Uh-huh.
The most difficult medication to come off of was Ambien. I was addicted to that drug. I didn't know how to sleep without it. Because every time I went to the doctor, they gave me a prescription. It's a terrible drug.
Right. Well, I'd love to talk about that, because that's part of your wheel of the lifestyle medicine.
Yes,
kind
sleep.
of. Yeah, is sleep hygiene. All right. So at some point, you decide to like throw away the cane, and you decide to start running marathons again. Or run a marathon, right?
To run a marathon, yeah. Running a marathon was not on my bucket list. It was not anything that I was interested. I mean, you're a triathlete and an Ironman, yes?
Yeah, it used to be.
Yeah. But I mean, this was not part of me or anything that I was interested in. It just came by. My brother had run in 2003, ran the Los Angeles Marathon, and as this awakening came to me, and he started to see me flourish and started to see this transition, he said to me, he lives in Los Angeles, came to visit me in New Jersey one summer, and he looked at me and he said, "Oh, I think you should run a marathon." And I looked at him like I wanted to kill him.
Yeah.
Are you crazy? MS patients don't run marathons. I have MS. I was angry at him for even suggesting it, and that was like another one of those moments. Like, I have to drop that label. I was living my life as this woman with MS first and foremost.
Yeah.
I wasn't Saray. I wasn't Dr. Stanzik. I wasn't Ralph's wife or Nick's mom. I was an MS patient first.
And did you let people know that?
Well, I think no. I was always very careful to share it. I didn't want people to, because and one of the things that really bothered me that was very difficult for me was being a physician with a cane, a young woman with a cane. So the first thing they ask is like, why are you walking with a cane?
Yeah.
And then you don't want, I'm there to serve that patient. I'm here to talk about you, not about me. But it was always this, so then like, what do you do? What do you tell? And then if you tell them, then like, oh, so sorry. Then you get that, and I didn't like that at all.
Yeah.
It's brutal. And I have to say this, I'm not cured. I mean, I live with multiple sclerosis. I have a lot of respect for this disease.
Yeah.
Today I feel great. I don't know what tomorrow will be, but I live in the moment, and I'm joyful and grateful for today and to be here with you. But I do all I can each and every day to keep myself healthy and to care for myself. But I have a lot of respect for the disease, and I don't know what tomorrow will bring. But I'm certainly doing my best each day to keep it at bay.
Yeah. Well, and there are a whole host of autoimmune diseases that are out there that it feels like when I was growing up, I'd never heard of lupus. I'd never heard of,
They're growing exponentially.
Rheumatoid arthritis, although MS, there's a handful of them. Yeah, growing exponentially.
Yeah.
Do you think it's related? What do you think is the root cause of that?
There are some theories as to what that is, and I think I read about it in the book. But some of the leading theories are the hygiene theory is one of them. That do you know what the hygiene theory is?
I know.
So that when we were kids, we would play in the dirt, and we were exposed to many more bugs, and so you're building your immune system, you're fortifying your immune system. So nowadays it's very different. Well, we're in the midst that we can talk about COVID, but nowadays we readily we have antibiotics and vaccines, and we Purell our kids. We don't. It's not the same. We don't grow up the same way. Kids don't grow up the same way as we did. So that's one of the theories. Another theory is...
Do you know who Robin Shakan is?
No.
Dr. Robin, she's a gastroenterologist.
Okay.
And her whole motto is eat clean, live dirty.
Yes.
Right?
I like
so
that.
That's like the hygiene right there.
Yeah, the hygiene.
Okay.
Obesity is another theory. And then social, like stress and alcohol. And so those are all, I think it's the environment, the world that we live in today is likely contributing. But we've seen this over the past 3 or 4 decades, an exponential, near exponential growth in these autoimmune diseases.
Yeah. We'll get right back to Dr. Saray Stancic. But first, when we announced the return of our in-person retreat this year, we were bowled over by the response that we got from all of you. Suffice it to say that our team is more than ready to get back together, but we weren't sure if you guys were ready. Well, you absolutely were, so much so that we filled up our Sedona experience super quickly, and we have a long wait list of folks that are interested in attending another Plant Strong retreat. So we called our friends in Black Mountain, North Carolina, just outside Asheville, and we found a week in late September from the 25th to the 30th to be precise, when we could bring the band back together and invite more people from around the globe to come together for an incredible week of learning, fellowship, and a whole lot of laughs. Our schedule, as you can imagine, is jam-packed with daily workouts, cooking demos, small group discussions, talks by my father, Dr. Caldwell B. Esselstyn Jr., my mother, Ann Kreil Esselstyn, the one and only Dr. Michael Clapper, my sister, Jane Esselstyn, cardiologist and lifestyle medicine physician, Dr. Brian Aspel, and many more. So for all the details, click on the link in the show notes or visit plantstrong.com and then select the Black Mountain Retreat. I really, really hope to see you on the mountainside. Second, our first of the new Plant Strong products are on a truck heading to our fulfillment center in Plano, Texas, right this second. I cannot wait to unveil this first phase of delicious new foods for you guys. If you'd like to have early access, visit plantstrongfoods.com and enter your email to be on the list. Finally, I know that food is front and center for most of my listeners. It is for me as well. And whether I'm dishing on the latest food trends that show how the tides are turning, or how we're discovering new products that are packed with nutritional integrity, we all love and connect over food. To that end, we are launching a new mini podcast called Plant Strong Snackables. It will run twice a month and will give you bite-sized nuggets, tasty meal ideas, and foods to get super jazzed over. Watch your inbox. I'll let you know when it's ready. Okay, let's get back to Dr. Saray Stancic. When did you first open the Stanzik Lifestyle Medical Clinic?
It was, I think, 2012. Late 2012.
And you did that because you were just so convinced that lifestyle medicine was where it was at, huh?
I think, yeah. I was in infectious diseases for nearly 20 years, I guess, and it was good work. I'm proud of that work. I mean, I cared for patients with HIV and hepatitis and worked in research and developing better treatments. Very special career, but what always kept coming back to me was this lifestyle medicine, plant-based, this nutrition piece. I mean, I was managing my patients and talking to them. Back in 2005, the VA started a program called the MOVE program, which was sort of like lifestyle medicine light. They wanted to bring attention to lifestyle behaviors in veterans. Because like everyone else, veterans are also suffering from the chronic disease epidemic, very high rates of mental health issues, and so they introduced this idea: we're gonna pay attention to diet and exercise and stress, and I'm the chief of infectious diseases, and when this program comes to our VA, I volunteer to be the director. I'm like, I want to do that. So I started walking with vets at lunchtime, and we started to teach them how to eat a healthy diet. And I started to see these vets shedding pounds, shedding prescriptions, looking happier. And we had like a multidisciplinary team. We had a physical therapist, we had a clinical psychologist, we had an RD, and we worked together to support these patients. And I saw that early, wow, this is powerful. And then, I went on I'm the infectious disease doc, and I ended up moving into the research realm, and I worked in that capacity for a while. But even when I was working in research, I would give nutrition classes at lunchtime, like volunteer, and people would show up. And I saw that it was making a difference in my peers. And then at some point, like I said to Ralph, this is going to sound crazy to you, but I think I'm going to give this up and I'm going to start this practice.
And when did you first have that idea?
Probably early in 2009, but everyone kept talking me out of it.
Right. So it took almost 3 years for you to actually act upon it and make it happen. Wow.
Yeah, because I was continuing to do the work that I was doing, and I was doing it well, but I was sad. I knew there was something that I needed to put out into the world.
Yeah.
It couldn't, and it very likely was going to fail, and maybe it wouldn't make a difference, but I had to do it. So I told Ralph one day, because I would tell a friend, a colleague, what do you think? I think I want to do this. And then they would say, are you crazy? You're an infectious disease specialist. You're well known in that field. You're really good at it. Look what you've accomplished. You're just going to give that up and start something called lifestyle medicine. What is that? You're a doctor.
You're a kook.
Yes, you're crazy. You've lost your mind. So they would talk me out of it. And then one day I sat down with Ralph, and I remember saying, honey, I have to do this. And it was a sacrifice. I knew I was giving up my salary, my benefits, everything. And we have 2 kids. And he said to me, I believe in you. If this is something you feel, you've been talking about this way too long, you have to do it.
You did it.
So I did it. And I had 0 patients when I opened the door, crickets. And how do you bring people in? Nobody knows what lifestyle medicine is. Few people do. My peers know me as an infectious disease physician, so typically your peers are your stream of referral, but they don't know this thing called lifestyle medicine. They think Stancic's lost her mind. She's crazy. So I just went out and I started to give lectures at the local free public library, that kind of thing, or go to a church and talk about plant-based nutrition, talk about lifestyle medicine, share my story. And people started to call and come in. And
last year you had how many patients?
I think at more than 1,000.
Wow.
Yeah.
Wow.
And one of the really cool things about the practice that I could have never predicted is that I had several patients in my practice. At some point, I just lost count, that were doctors, and that came to be because at some point we had a patient in common. I had an endocrinologist.
Yeah.
Who, one of their patients had come to see me, a poorly controlled diabetic, 15 years of poorly controlled diabetes, came in. We worked on their lifestyle, their diet. Was able to come off of every one of those medications. Hemoglobin A1C went from 12 to 5.2.
Wow.
Loses all this weight, goes back to see the endocrinologist for their 6-month follow-up or whatever, and they're like, what did you do? And then
blueberries.
Then the endocrinologist calls me, and what are you doing? And we have a conversation. I share the literature.
Yeah.
I share the literature, and then they say, you know what? I'm really curious. I want to come see you. And I always think it's let's sit down, we'll have a cup of tea. But no, I want to come see you as a patient because I, the endocrinologist, am pre-diabetic. I'm hypertensive. I'm depressed. So then, every patient is a privilege to care for. But when I have a patient who's also a doctor, I know in supporting that individual to optimize their lifestyle, that's going to pay it forward in great fashion, because now all of a sudden the way that they practice medicine moving forward has changed.
Yeah.
It's been modified, and that's going to affect each and every one of their patients and each and every one of their experiences with other peers. I think we have a responsibility to educate and act as mentors for interns and residents and medical students. And so it's this beautiful, all of a sudden it flowers, you know, and we can, by changing one life, or by introducing these powerful aspects of lifestyle, it's infectious in a beautiful way.
Listen, I have seen it firsthand for close to 35 years with my father's work.
Sure.
And what he's done with heart patients, and then cardiologists that have been so impressed with the results, and now they're coming and they're trying to learn the technique and follow it themselves.
There's definitely a movement in the field of medicine that we need. This is information that needs to be integrated into the curricula of every medical school, and that we're recognizing that it is an important therapeutic intervention that needs to be added. And I think if we do that, it's going to be quite a wonderful period.
Well, it absolutely 100% needs to be added. It's like the foundation of everything. And
exactly.
As we were talking before this, I mean, or maybe during, but 90% of these chronic Western diseases could basically evaporate overnight, practically, if we could just get everybody to adopt this. So you in your book you have a, and I want to talk about the book.
Yeah.
But in the book you start out by saying how the Hippocratic Oath is 341 words.
Yes.
And you've kind of broken that up, and you've taken what you think is the most important part of that Hippocratic Oath. Can you say it? And if you can, great. And if not, I can tell you what it is. But
well, I always say to my medical students, it's 341 words, but the 13 that are most important to me is, I will prevent disease because now I'm confusing.
That's right. Yeah.
I will prevent disease because prevention is preferable over cure.
That's exactly right.
Yeah.
I mean, to me, and I want to repeat that again because I think it's so powerful. I will prevent disease whenever I can.
Yeah.
For prevention is preferred to cure.
Sure.
And how many physicians are actually, they're looking for the cure and they're not even looking at prevention? It seems to me the vast majority.
Yeah. By no fault of their own.
No, right.
Because that's the way they're trained.
Right.
You know, we're trained on the foundation of medical school is pathogenesis. We learn the disease state. We become experts at recognizing pathology. So we collect data pieces. You know, we take a thorough history and physical exam, and we do labs and imaging studies, all in an effort to ultimately make a diagnosis. And once we have that diagnosis, what we're taught is the intervention is a pharmaceutical agent, a procedure, or a surgical intervention. That's what we're taught. That's the world that we live in. What we don't learn in medical school is the mirror image of salutogenesis, and that's...
What was that word? Say it again.
The mirror image of pathogenesis is salutogenesis.
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 Ooh.
Salutogenesis is the study of health and well-being. So when you're in medical school, you only get half the story of the human health continuum. You learn the disease state, but you don't learn the health state.
Why do you think that the most important half, this salutogenesis approach, has been missing from medicine?
I don't know, Rip. I think that that's the million-dollar question. Why has that been missed? Why is there no emphasis placed on it? And I think that maybe early on the physician's role was really to treat the disease. I don't know, but I think that the chronic disease epidemic that we have today, and what we've learned through much literature, is that it is this man-made epidemic. So much of what we're dealing with today in clinical medicine is largely a result of the behaviors that we've adopted over the past several decades. And the solution to the problem is this idea of salutogenesis. And I think that it's catching on. I think that physicians are beginning to acknowledge that the solution to the diabetes epidemic is not to develop yet another drug to treat diabetes, because we keep developing them and the diabetes epidemic continues to grow. I mean, 2% when I was a medical student, 10% diabetes rates today, and the CDC predicts by 2050 it'll be 30% by the time my son is my age. Think about that.
This is 30%. This is not pre-diabetes.
No.
This is just that have diabetes.
Diabetes, which is
type 1 and type 2.
right, primarily
Primarily 2.
2.
Yeah.
But this is a disease that we could prevent, and it's ever growing. And currently, what we're doing primarily is to address this diabetic population. We're continuously developing new drugs, new targets to treat the disease. Yet, every endocrinologist who's a diabetologist or internist this should be the primary message that they're conveying.
I'm actually surprised that it's that low, that it's 30% by 2050, because you just talked about the obesity rates, right?
Yeah.
When you wrote the book, they went from 39 to 41, I think it was.
42.
42 in just a year. And I would imagine
Yeah.
that the diabetes rates totally
those numbers, the CDC,
are right in line with that.
Yeah, the CDC made those predictions a few years ago. They may have to recalculate. Yeah, we can't continue on this path.
Yeah.
The healthcare system will collapse.
Yep. So do you feel like? So you started the Stanzik, lifestyle medical practice in 2012. You've done a documentary, Code Blue. You wrote What's Missing from Medicine. You're going after it. You're trying to get this message out in a big, wonderful, powerful way.
Yeah. Well, it's so important to me. I mean, this drives me. This gets me up in the morning. Because this problem is solvable.
Yeah. Yeah.
We just have to coalesce our voices, and we just have to empower individuals. And I think, and this is what I tried to cover in the book and in the film. I mean, in the film, for me, it was about shedding light on this lapse in medical education. Because in order for us to do this, we need to change the way doctors think. We need to change the way that they're trained, so that because here's the thing, if I spend 2 hours with a patient talking to them about their diet and their lifestyle, and then they go see their cardiologist next week, and the cardiologist says, Stancic's crazy, ignore everything she just said, then it doesn't work. We all need to speak to this unanimously and ubiquitously. Otherwise, it falls through the cracks. Behavior modification is really hard, so we all have to work. All these touch points from different physicians and healthcare professionals are necessary in order to get people over these difficult. I mean, it's not easy to change your habits after you've been living a certain way for the first 5 decades of your life.
Yeah.
Right.
Yeah. No. Need a united front.
You need a united front, and we need. And the wonderful news is that I see it. I see this movement washing over the country. I see it especially in medical students and in residents who get it. Maybe my peers are a little bit slower to warm up to it. They see something, but they're not quite there. But these young kids, they get it. I mean, they're excited, and they want to make a difference. So when I see some of my medical students that are now residents and they're now educating medical students, and you can see that ultimately these kids are going to be the chair of medicine. They're going to be the CMOs at different hospital and healthcare settings, and they will demand these changes. Yeah. And that's exciting.
I want to dive into the book.
Okay,
because you have the lifestyle medicine wheel, and you have the 6 spokes of the wheel.
Yeah.
And one of the things I love about just the way you are, the way you speak, the way you write, is you're just a straight shooter.
Yes.
You keep it nice and simple, straight shooter, and you know exactly where you stand on things.
Right.
And I think it's served you really, really well. So before I ask you about the book, Where do you think you got your spirit from? Your way? Is it from your mother, your father, somebody you grew up with, just the way you were born?
Yeah, I think my parents. I'm an immigrant to this country. I was born in Cuba. My parents, gave everything up to leave their country to bring us here, to give us this up. It was communism, and they lost everything, and they came here in the late 1960s and worked really hard. Had to work in factories. They didn't know the language, and urged hard work, ethics. Your word meant everything. So I just came from really strong family, and lots of love in my family. This belief that you can do anything you want to do, regardless. We grew up. I grew up my early life in Newark, and we didn't have much, but we had a lot of love, and we had. My mother near daily would say to me, "You can do anything you want to do. Don't let anyone ever tell you that you're not capable of achieving anything."
And for 3 years, well, and you let that neurologist tell you, and then people, but you stuck to your guns.
I did.
You did.
And and at times it wasn't easy. I have to say this, it wasn't always perfect. There were setbacks.
Yeah.
And then there were people, of course, the minute something goes wrong, everyone crowds around you and says, "See, we told you."
Sure.
And so, but I knew in my heart, in my gut, that I was going in the right direction, and I just needed to stay on the path and not get, distracted.
Yeah.
And it ultimately bore fruit for me. I crossed that finish line in 2010. That was 7 years after I started. But when I crossed, again, it was never a dream of mine to run a marathon, but that was symbolic. Crossing that finish line, I did something that I didn't think was ever, that I would ever be capable of doing. And I was so proud of myself in that moment, because every sacrifice I had made, every risk I had taken had paid off. And now I felt like I have to share this message with as many people as there are willing to hear it. This year, October 11th, 2020 was the 25th anniversary of my hospitalization, my diagnosis. That night when I woke up, age 28, numb legs, MS, wheelchair 10 years. That was 25 years. I walked 25 miles on that day.
Let's dive into some of these spokes of the wheel. And go ahead.
So the wheel, I use that analogy because the spokes, they're interconnected. And so the point that I'm trying to make there is that every aspect of lifestyle is important. Some of us are really good at food, or some of us are really good at exercise, and then we drink too much and we're super stressed. So I think it's important that in order for us to achieve our best self and reduce our risk of developing chronic disease and live our optimal existence, we want to pay attention to all 6 spokes, right? So the 6 spokes are nutrition, exercise, stress, sleep, addressing substance abuse issues, and then social interconnectedness. We know those of us who have love and support in our lives are more likely, or less likely rather, to develop depression and anxiety, live longer. So social interconnections are also very, very important. And so paying attention, so the book gives a chapter to each one of these spokes, but I think it's so important that we understand that they're sort of in large part are interconnected and rely on one another. We know, for example, if we exercise, we're going to sleep better, right? So when we do that, we live, I think, our optimal existence, and that's really my hope for every one of us, right? Imagine if each and every one of us lived to our greatest potential and accomplished our greatest potential. I say this all the time, but I'll say it one more time. My hope is that not only do we live to our optimal potential, but on that last day, be it 92 or 102, on that last day, that we experience a beautiful, a happy, joyful day, surrounded by our loved ones.
Yeah.
And then at the end of that day, we go to bed and we pass away peacefully, right?
Right.
Isn't that the beautiful ending to a well-lived life? Regrettably, as a physician, I have witnessed that pain and suffering that so many of us end our lives with in the nursing home, demented, wearing a diaper, pressure ulcers, suffering. And it's difficult to witness that for that individual patient, but also for the family who has to also see their loved one suffering. And it shouldn't be that way. I think that, again, that's another, in our society, that's been normalized, that's the way life ends, that you must be in a nursing home, and that's just part of it. That's part of the deal. And it doesn't have to be that way.
Yeah. I want to go through these one by one.
Yeah.
You don't, whatever makes sense as far as how much you want to talk about it, but I'm going to kind of feed you some information, and then I want you to, go do with it what you want.
Okay.
But the first one really is it's the food, right?
Yeah.
It's the food, and you just say, eat more plants, right?
Yeah.
So what do you eat in a typical day?
Well, I only eat I don't eat any animal sources in my diet. I mean, do you want me to give you like a menu of what
I'd love to know
Yeah.
what you typically eat for, what's a typical breakfast, a typical lunch, and a typical dinner?
typical breakfast for me, right now I'm traveling, so it's a little bit challenging, but it's typically oatmeal
Yeah.
with blueberries or raspberries or berries, lots of berries.
Frozen or fresh, does it not matter? What do you like?
In May and June, when berries are in peak season and they're readily accessible in New Jersey, I buy them fresh, but I always have frozen in my freezer to throw in. But there's always berries included in my oatmeal in the morning. I throw in some flaxseed, a little bit of cinnamon, and I'm happy with a cup of coffee. That's typically, and often maybe I'll have another piece of fruit, like an apple. I eat a lot of fruit. Lunchtime, I will typically have a big salad, something like that. Lots of color. I am a big chickpeas, beans. I mean, black beans are my favorite. I'm Cuban, so black beans are one of my favorite.
Yeah.
But I eat a lot of legumes, and I eat probably a piece of fruit mid-morning, mid-afternoon, just as fuel if I need it.
Yeah.
And then dinner, it varies.
Do you usually have a dressing on that salad?
I just add a little bit of balsamic vinegar. I that's it.
Okay.
I keep it really simple. Or I might add some lime or even some orange. Like I'll squeeze an orange over something. Like because I'm Cuban, lime is big for me. A little lime and cilantro on a salad for me is awesome. But I like to taste food. I don't add a lot to stuff.
Yeah.
And very simple, very simple. Like I'm happy with some brown rice, some black beans, and some cucumbers, avocados.
Yeah. Well, I'm glad you said that, because I find that so many people, they smother their food with dressings and just things that prevent you from really tasting the real beautiful sublimeness that's in the red bell pepper or the mandarin orange or the chickpeas or whatever.
Absolutely. And I add a lot of herbs to things. Like I have one of those like in my kitchen, it's growing basil and cilantro and parsley, so I'll throw something like that onto a dish, and it just opens it up, and I just love it.
How about dinner?
So, I tend to be, again, my Cubanness, I'm a big rice and bean. That's one of my favorite dishes. So any type of rice and bean dish is very popular. My husband's Italian American, so we do a lot of pasta with zucchini, broccoli rabe, dishes like that. A lot of veggie dishes and pasta.
How about, do you have a dessert ever, or is it just fruit?
It's fruit for me. Yeah, I mean, on occasion I do like chocolate. I'll have it.
Yeah. Is Ralph also plant-based?
He's plant-based, yeah, and he's a 6-time Ironman.
Oh, so good. He's fit.
Yeah.
How about your 2 children?
My kids are also plant-based. I mean, I'm not one of these moms that makes 3 different types of meals for everybody. You eat what I've prepared, and if you don't eat that, then you're not eating. I mean, we're very, they're plant-based. My daughter sometimes can be a little bit challenging, but she's 17, but in our house, we make what we make, and they'll eat what I prepare. Yeah. Now I can't control what she does when she's in school, but yeah.
Okay, so eat more plants. So exercise, you say play more. I love the fact that you're saying, let's try and figure out how this can be playful.
Yeah.
To make it fun.
Because I think so many of us think that you have to, when you start an exercise regimen, that it has to be all or none. And some of us who maybe have been sedentary for a long time and just feel like I'm scared to go to the gym, I don't feel right. It just find something that you enjoy doing. Just start with a walk. I know, the physical activity guidelines say that we should include at least 115 minutes of moderate physical activity per week and 2 sessions of resistance training. Yeah, absolutely. And we want to build to that. But, the average patient that I see in the clinic setting is doing nothing. Mm-hmm. And so you can't throw that at them day one, like, do this. We have to build that. That's an important point that I want to raise is in our country, we want the quick fix. Mm-hmm. Right? That's like, the pill that's going to fix the problem. Lifestyle medicine and behavior modification is about investing and taking small steps in the right direction. Right? And not feeling like if you don't do everything in a week or in a month, then you're a failure. Mm-hmm. And we're so hard on ourselves, Rip, if we don't accomplish that thing, we don't lose those 10 pounds in the first month, then I'm just going back to my old ways. And I wish we would walk away from those because I think that sets us up for failure, and it sets us up to sort of replay this. And the whole scenario, I'll start Monday my diet, this whole idea of dieting and calorie counting and weighing food. And I mean, I grew up in that generation. I call it the, Oprah Winfrey generation, where we were all fixated on losing weight. And how did we do it? We drank Diet Coke and Tab, and we ate, 100-calorie bars that were just processed garbage just to keep the calorie count down. Mm-hmm. And the wonderful thing about plant-based nutrition is that you can eat ample food because you're eating these plates that are nutrient dense but calorically deficient. Yes. And so we can eat so profoundly. So finally, I just want to tell every woman in America, fill your plate, because you're not going to gain weight. I mean, think about it. How much broccoli do you have to eat in order, 100 calories of broccoli, that's a big plate.
You have to eat about 40 pounds.
Right, So it's about our relationships with food, particularly women. We have this terrible relationship with food. We see it as this villain that when we eat it, we feel guilty because then we're going to gain weight. Mm-hmm. And we're not going to fit into that. And I want to change that perspective. I want people to find the joy of the flavors of food, the beauty, and that you can eat and feel satiated both physically and emotionally, and maintain a healthy weight. Mm. And it's not so, and sort of the weight is not the main outcome that we need to measure, right? It's about our health.
Yeah.
It's our ability to live disease free. It's about our quality of life, our ability to experience joy.
Yeah, if you can get past the superficiality of just trying to lose weight,
yes,
and then make the end goal be just to get supremely healthy, the weight always takes care of itself.
Exactly.
It's just a byproduct of getting healthy. It's a beautiful thing.
Yes.
So number 3 is stress, and you say stay present.
Yeah.
Which, I mean, I think is like perfect, especially with everything that we got going on right now. Yeah. And it seems like so many people they are maxed out. They are stressed.
Yeah. And for me, learning that practice of mindfulness and seeing the world differently, like sort of stepping out of myself and looking at the world with a new set of eyes, a new perspective. The day I was diagnosed, if we would have had an interview on that day, I would have said to you, this is the worst day of my life. My life is over. When I look back in retrospect, I can say that it was probably one of the best days of my life, because it put me on this path. And that moment of suffering and that pain that I experienced subsequently, I needed to have that in order to evolve to who I am today. Mm-hmm. And I think so many of us, whenever something doesn't work out in our favor, or there's an obstacle that presents itself, we lose a job, or we lose an opportunity, or a friend, we needed to have that experience in order to get us to the next stage. So when you have that perspective, then there's this like release. And so like everyone else, I have to deal with challenges and at points sadness in my life, and things that seem unfair. But at the end of the day, what was it that when we were talking before, what you said about Anthony Hopkins?
Basically how everything is important, but really in the reality, nothing is important.
Exactly. And that's where I am. I see that.
Yeah.
And I believe that everything is, everything that presents itself to me, it was a necessary experience for me. Mm-hmm. And so I accept it. And Eckhart Tolle I love his books. There's a particular book called A New Earth that has just been very important in my life. I think I've probably read this book more than a dozen times. Whenever I have a difficult moment in my life, I turn to it, and his words just really bring me so much peace.
What's the book?
A New Earth. A New Earth by Eckhart Tolle. So he's a mindfulness.
Yeah, I've heard.
He's written another book, Power of Now. You might know that one. But A New Earth is my favorite. And he talks about suffering. And he says we suffer when we resist what is. When you accept, and it's so true, when you accept whatever condition is presented before you, the suffering ends. The suffering is when you push against it, when you won't accept it. Mm-hmm. And then that was one of those moments like, wow, that's really profound. Mm-hmm. That really makes a lot of sense. And all of a sudden, I started to apply this principle in my life, and I found that there was a lot of peace that came from that.
Mm-hmm. Well, I find that staying present and being in the moment it's one of the hardest things to do, but if you can do it, it's one of the most beautiful things. Like with my kids, right?
Yes.
Just being able to like turn everything else off, get my mind focused, and just like be in the moment with them. Whether it's playing cornhole or looking at something that they drew, or playing a game around the dinner table, or whatever it is. But you just gotta like just jump in, both feet. Next thing, sleep hygiene. You say, sleep, rest well. Obviously, you had your own issues with the ambient, and it seems like a lot of people with screen time and everything else are not sleeping well these days.
No, it's a big problem. But for me personally, I think of all of the spokes obviously were incredibly powerful for me, but sleep is one that I am most proud of, because it was so difficult to overcome. It really was. Coming off of Ambien and other sleep agents, anxiolytics like benzos that I was given, to come off of those medications and really learn sleep physiology and understand it was so incredibly important for me. Understanding the importance of the environment. The room should be cool, dark, and quiet. I mean, these are not things that I learned in medical school. This is just going back and really understanding that what are my pre-sleep rituals? What was I doing throughout the course of the day that could affect my sleep? Was that glass of wine or 2 glasses of wine affecting my sleep? Looking, particularly nowadays.
I've had more friends of mine tell me that if they have a glass of red wine, their sleep is shot.
Yes, it's shot. It affects your, you're not getting into those stages of sleep.
Yeah.
And we need to get into those, deep stages of sleep, because that's where we recuperate and we regenerate. So really understanding that whole process, and creating structure. Like, one of the most important things is that we need to, in order to be a really good sleeper, you have to have structure. So you really have to, people don't like to hear this, but you really should set a bedtime and a wake up time, and in between those two, 8 hours, right? And be fixed. So I go to bed, people laugh, but this works for me. I go to bed at 9 o'clock and I wake up at 5.
Wow.
And Rip, I call myself a professional sleeper. I'm so good at it. And I sleep so beautifully. Like, I go to bed. I fall asleep within 10 minutes. And then I wake up. I don't have an alarm clock. Like today, I woke up 5 o'clock.
Do you ever wake up in the middle of the night to like roll over or pee or anything like that?
Yes. So having lived with MS does a lot of damage to the bladder. So yes, I probably have to get up 2-3 times at night to go to the bathroom. But I can, it's almost like I'm doing it sleepwalking. I can do it and go right back to bed. It doesn't really interfere or interrupt my sleep, because I go right back. And I feel so good. When I wake up in the morning, I feel so energized. I typically go for a run or a long walk or a hike. And I feel creative. So 5 o'clock in the morning for me is like, wow, there's a lot of good stuff going on up here. I just feel my best.
Do you wear a mask?
I don't wear a mask.
Earplugs?
No, I have blackout shades. There's no television in my room.
Do you have white noise?
No, I live in a really quiet environment. I'm not in the city or anything like that. But
do you have a down pillow? What kind of pillow do you have?
I have a down pillow. Yeah, so the bedding's great, and it used to be at one point that sleep was like torture for me, because I would get into bed and I would worry about things.
Yeah.
That's another part of the stress piece. I would stress. I was the worst as a young woman, medical student, resident, worrying about my boards and, was I going to get into this fellowship or this residency? Was it just constant, am I going to pass that exam? It was always a lot of stress around sleep time. And so I get in, sleep has just been for me, and before I go to bed, there's always a period of about 5 to 10 minutes of meditation or gratitude or prayer, whatever you want to call it. I think it's important. And I do this also in the morning, offer my gratitude. Every morning I wake up and I feel everything, and I'm in one piece is joy.
Yeah.
Yeah.
Good. So I sleep, rest well. Substance intake. Seems like a lot of Americans, whether it's drugs, whether it's nicotine, cigarettes, whether it's alcohol.
It's a problem.
Yeah. And you're, I love what you say. You say basically, thrive without.
Thrive without,
right?
yeah.
Thrive without.
Thrive without. I think, on occasion, I'm not saying, here's the thing, there's no safe amount of alcohol. There really isn't. Even one glass of wine can...
The safest amount is the least amount.
Yeah. So with that said, I know that on occasion, I enjoy a glass of wine on occasion. It's not something I do every day.
Yeah.
But I think it's important that that's voiced, because in our country, alcohol is, again, very much normalized. It's part of everything we do. We go to a game, we have a drink. We go out to dinner, we have a couple of drinks. Every gathering, so it's very much normalized. And I think that we need to understand that there is some risk there, and that we need to become mindful about how much we're consuming. So if you go out to dinner, stop at that one glass. You don't have to have the second one, because when you lose that attention or that mindfulness, then you're gonna, okay, I'll have another one. And think about it, what you're doing and how you're using alcohol. Are you using alcohol to take the edge off? Are you using alcohol to deal with your stress from your job? Or are you using alcohol because I went out with Rip, we had a beautiful dinner, and we had a wonderful glass of wine because we were celebrating? That's very different than using it to take the edge off. So those are questions that I would, that I want to have with patients so that they become a bit more thoughtful. Now, the substance abuse chapter for me, too, was not just talking about all that we just listed, but I also included a little bit on supplements.
I saw that.
Yeah.
Vitamins and stuff like interesting. I think that bears some explanation.
Yeah. Well, the supplement industry is a multi-billion-dollar industry, and we turn to it as if, again, it's the magic pill. It's going to solve the problem. It's not. I mean, the evidence isn't there that it's really making any difference, and it can potentially do damage. And I don't know if you had a chance to read it, but I shared a personal story there. Back in 2005, when I was feeling really good, I read a book. It was a doctor who talked about supplements and how they were, if you take these supplements, your health is going to improve. So I'm thinking, wow, I feel pretty good right now with this lifestyle thing. If I add the supplements, maybe I'll feel I don't know, I can run 10 marathons. So I started taking the supplements that this fine doctor was prescribing in his book. 2-3 months into this, I found myself losing weight, developing nausea and vomiting. Ultimately, I ended up in the hospital with something called drug-induced liver injury. These medications, these supplements, people don't consider them medication. They are. Mm-hmm. They're metabolized through the liver, and they can interact. They're not monitored by the FDA. They don't need to gain approval through the approach that we would for a pharmaceutical agent. So I took these supplements, and it nearly killed me. There's a 10% chance of mortality with drug-induced liver injury and even liver transplantation. I was in the hospital for 2 weeks, and it took 6 months to recover from it.
So are you taking like handfuls of supplements when you said that?
Yes, I was taking, because this person, and there are
who
many
shall remain unnamed, which is fine.
Shall remain unnamed, but they're out there. The books are out there, and they sell the products under their name.
Yeah.
And I was taking what the doctor said was necessary, and it was probably 12 pills.
Well, I would imagine if somebody like you decided that this was a good idea and worth exploring, there's probably hundreds upon hundreds of people who are doing the same thing, and probably also having similar results. I would imagine that
this is not an uncommon phenomenon, drug-induced liver injury. I actually went on to write a paper on that topic with a group of experts. I was, at that time, when I recovered from that, I was working for Roche Genentech as a scientist in developing treatments for hepatitis C, and so I worked in this liver disease realm or space, and there was an opportunity to join a group that was looking at drug-induced liver injury, and it was quite a learning experience for me to work with experts from across the world, and we wrote a paper on it. It's a real concern, and I think it's important for individuals who are just out there thinking, I'm going to go to the supplement section of the store and I'm just going to buy all this stuff, and think that it's only. I think a lot of people think, well, it can only do good. It can only help me.
Safety net.
Yeah, exactly. No. Yeah. Be aware and be very, very careful. And always, if you're taking any supplement, tell your doctor. Don't, because you'll ask a patient, are you taking anything? And they'll give you the medications, but they ignore the supplements. And sometimes they can interact with medications. So always be fully transparent and share everything that you're taking.
So would it be fair to say that outside of maybe B12, that if you're going to consider supplementing with anything else,
you should have a conversation with your doctor. Many
make
of
sure
us,
there's a no deficiency?
Yeah, like vitamin D is something is that might be something that you need to supplement. There was a paper just yesterday that actually Dean Ornish forwarded to me about, and this has been recognized.
Who wrote the foreword for your book?
Yes. Yeah. This has been recognized for some time, that low vitamin D levels maybe playing a role in MS. So certainly vitamin D is something that I monitor in myself.
When you say, because it seems to me like the jury's still out on vitamin D.
It is.
And what are low levels and what are appropriate levels? I
Yes.
mean, do you have an opinion on that?
Yeah, I do have an opinion on that, and I think that I didn't speak to it directly in the book because it's a field that's always changing, and I think that the recommendation may vary for the individual, so I don't like to give recommendations. I think it's something that should be looked at. But you're right, the jury is out. I think at one point, and this happens every decade in the field of medicine, we get enthralled with some vitamin.
Yeah.
And then we overprescribe it. And then at the end of the day, it does nothing, right? So this happened with beta carotene. This happened with vitamin E. And so we end up writing these mega doses. And what you need to do is get those nutrients from food.
Right.
But then the supplement industry doesn't.
So is below 10? Would you say below 10 on your vitamin D is too low?
Oh, we don't know. That's definitely that's deficiency for sure.
And at that point, would you recommend
Oh,
supplementation?
for sure. That person, 10 microgram, you definitely need to be supplemented. But the question is, how much do you need to be supplemented, and how often do you need to be monitored? I mean, vitamin D is a fat-soluble vitamin. You can accumulate too much.
Yeah.
There are, in the field of MS, they ask patients to take very high doses, and they want levels of as high as 60. I just don't. I have some issues with that because where the evidence is and what value might come of that. But I think it's a field that is ever evolving. I think most physicians would agree that vitamin D has sort of many of the studies that we've done, and it's been looked at in heart disease and diabetes and MS and all, most of these studies have been null. That really haven't shown that that if you supplement that it makes a difference. But I think this is a trend in medicine that we every decade are enthralled with some new vitamin or nutrient.
Yeah. So let's be really careful with that.
Yeah, to be careful. The most important thing we need to do, and the simplest approach to living that optimal existence, is the things that we've just talked about. It's so simple. Like, what could we do, Mr. Smith? What could we do to include more plants on your plate?
So, Saray, I'm Mr. Smith. I come to you. I am about 40 pounds overweight. I have a fasting glucose that's about 120. I have elevated blood pressure, and I have high cholesterol, so I'm on some statins for that as well. What would you tell me to do?
The same thing I would tell Mrs. Wilson, who has MS. It's the same prescription. It really is.
Tell me what I should do.
Well, I mean, one of the first things I do when the patient comes in is they have some paperwork that they complete when they come in, right? So
yes.
So there's going to be a couple of days of their diet, so I know where they are.
Yep.
Right. So, and I have to assess in that time, in that hour that I spend talking to him about, who he is, because I take a really thorough history. I really want to understand everything about you. What is your willingness to change, right? Because we have to be respectful, and we have to understand where that person is. What are you willing to do? Why did you come here today?
I am willing to do whatever it takes to get me healthy.
So we're looking at what you're consuming. So for breakfast, you had bacon, eggs, and a biscuit.
I have that 6 mornings a week.
Yeah. Well, let me tell you what this is doing to you, and then we're going to talk about how that's promoting because you're pre-diabetic and you're 40 pounds overweight, and if we do nothing, you're going to become diabetic, and so we're going to be proactive here, and we're going to prevent that deleterious path, because we're suddenly today, Mr. Smith, you were going in this direction, and now this is a new beginning for you, right?
Wow.
And we're gonna introduce this change by modifying your diet. So let's talk about what your breakfast would look like. What do you like? Tell me things that you enjoy for breakfast. Could you see yourself eating a bowl of oatmeal?
Love it.
Could you see yourself? Okay. So these are the things that we're going to start to introduce, and we're going to talk about how it's really important to keep that plate colorful. And why is color important? When you walk into that grocer in that produce section, all those beautiful bright colors that are staring back at you. What do they represent? That excites people, right? So patients will call me, send me pictures. Look how colorful my plate is. They're excited about it.
Yeah.
I have patients who have start an Instagram account. It's just me and them, and they, I'm the only person who can see it, and
Yeah.
they show all of their. So it's about inspiring them, engaging them, but understanding what are you willing to do today, and it doesn't have to be all or none. Again, the same thing that we talked, the same rule that we applied to exercise. Because I don't want you to do this for 2 weeks and then stop.
Yeah.
I want this to be something that, and there are patients that come in and say, Doc, I can do it all. I'm ready to do it now. I had that moment, the hallelujah moment. I'm doing it. Great. But the majority of individuals are not quite just there. And it's largely because I think culture, society, the rest of the healthcare setting is not fully on board. So again, I deal with that where I have a patient and they're also seeing the cardiologist or the endocrinologist or whatever, the rheumatologist, and they're not on the same page. So there are obstacles that there are hurdles that we constantly need to climb.
Yeah. So last is social connection, basically grow love, which I love.
Yeah, right. So we know from a lot of work done by social scientists Christakis and Fowler that the more connections we have, they're more favorable to outcomes. And it's also not just the number of connections that we have, but also the types of connections that we have.
Yeah.
Right. So if you have, if your best friend is, a sedentary alcoholic, that doesn't bode well for you.
Yeah.
But if you have Rip Esselstyn as your best friend, what are you likely to do? You're going to go out hiking. We talked about that nice walk outside.
Yeah.
So it's important to surround ourselves with like-minded individuals, right? So if you're in a community that maybe does plant-based potlucks, or engages in hiking events, very different than if we engage in a sedentary lifestyle. We're sitting in front of a television, eating and drinking beer and eating chips.
Yeah. So here's the book, What's Missing from Medicine. I just have it. I'm here. I don't have the hard copy, and
I'm sending you one tomorrow. I feel terrible that I didn't bring it.
But 6 lifestyle changes to overcome chronic illness. It's a beautiful book. Congratulations on that.
Thank you.
What are you most excited about right now, going forward?
Yeah, well, I think the future is about creating change on a global scale, and I'm sort of involved in an opportunity, and I'm not ready to talk about it prime time, but I will soon. Maybe I can come back and talk about it once we're out there.
I would love that.
But there's a very exciting opportunity with really good people, and I've had the wonderful privilege of joining this team of game changers that really want to not just create small things, but big things and change the world. And I'm so honored to be part of that team, and largely that opportunity came to me through you. So you are a blessing to me.
Well, it would be phenomenal if you could take what you've done with your clinic in New Jersey and figure out a way to replicate that
Yes.
all over the United States and the world. So
That's the hope.
hooray! Thanks so much for coming here this morning. I know it was super early, but I appreciate it. But you wake up at 5, so this is no issue for you.
This is my prime time.
Yeah. With that, let me say thank you for being such a trailblazer and everything you're doing to contribute to the health of this country and the world. It's not an easy path per se, but it's a worthwhile path, and you are, between Code Blue, between the clinics, between what's missing in medicine, and your positive can-do attitude. I can't wait to see what the next decade brings for you.
Thank you so much, Rib.
Yeah, thank you. Reflecting on this interview with Dr. Saray Stancic, so many things stood out, but what I really loved was when she said that she had to be willing to take the risk to treat her MS in what was at the time a super unpopular and unconventional way. She was willing to go against the grain and the opinions of some of her most trusted mentors to seek some semblance of a quality of life. And it all started with a picture of blueberries on the cover of a medical journal. I hope that this podcast empowers you to take some risks that you otherwise may not take. Don't worry though, we've got your back with tons of support and programs to assist you. Visit plantstrongpodcast.com or plantstrong.com today for all of our resources. Thanks for listening and keep it plant strong. Thank you for listening to the Plant Strong podcast. You can support the show by taking a quick minute to follow us wherever you listen to your favorite podcasts. Leaving us a positive review and sharing the show with your network is another great way to help us reach as many people as possible with the exciting news about plants. Thank you in advance for your support. It means everything. Have you had your own Galileo moment that you'd like to share? What happened when you stepped into the arena and shed the beliefs that you thought to be true? I'd love to hear about it. Visit plantstrongpodcast.com to submit your story and to learn more about today's guests and sponsors. The Plant Strong podcast team includes Carrie Barrett, Lori Kordowich, Amy Mackey, Patrick Gavin, and Wade Clark. This season is dedicated to all of those courageous truth seekers who weren't afraid to look through the lens with clear vision and hold firm to a higher truth. Most notably, my parents, Dr. Caldwell B. Esselstyn Jr. and Ann Cryle Esselstyn. Thanks for listening.